the classification of the antiretroviral drugs. Antiretroviral drugs. So what does this include? So first class we see is the NRTI. So what is meant by NRTI? NRTI stands for the nucleoside reverse transcriptase inhibitors. So what are the drugs in this case? The drugs in this case, it includes a zidovudine, then the stavudine and the lamivudine. Next we have some other drugs such as the abacavir, amitriptyline, then also the didanosine. Then we'll move on to the NRTI. So what happens to the NRTI? So in terms of the NRTI, it is known as the nucleotide reverse transcriptase inhibitors. So here in case of NRTI, the drug is nothing but the tenofovir. Next we move on to the NNRTI. NNRTI stands for the non-nucleoside reverse transcriptase inhibitors. So what are the examples here? Examples here are nevirapine, then the efavirenz. Next comes the delavirdine, as well as the etravirine. Then comes the PI, that is the protease inhibitors. Here there are a couple of drugs such as the saquinavir. Then comes the indinavir, ritonavir. So SIR. Then we have the nelfinavir. Then there is also the lopinavir. Then the atazanavir. Next, it also includes the TIP. It includes the tiprinavir and the darunavir. It includes the tiprinavir and the darunavir. Next comes the entry inhibitors. So entry inhibitors, it includes, there is the enfuvirtide, as well as the maraviroc. Then comes the integrase inhibitors. So what does the IIS it have? It has the raltegravir, as well as the elvitgravir and the dilute gravir. So this was about the classification of the antiretroviral drugs. We saw some classifications such as the nucleotide reverse transcriptase inhibitors, protease inhibitors, entry inhibitors, to name a few. To learn and grow daily like this, please do subscribe.